for any of us who are not taking this seriously yet, I hope this is a wake-up call.
A new case of the coronavirus was confirmed in Reeves County. Officials say the patient lives and works in Pecos. Midland Health also confirming another COVID-19 case. That patient is a woman in her 20s, and the source of her exposure is currently unknown. The total number of coronavirus cases in West Texas now sits at 7. There are 4 cases in Midland, 1 in Lee County, 1 in Crane County, and 1 in Reeves County. And Midland's Unified Command Team addressing the public again. Dr. Wilson with Midland Health said that some healthcare providers are now showing symptoms of COVID-19 after caring for some patients with the virus. Those healthcare providers are being quarantined. He also said 85% of people who get coronavirus will, quote, be just fine, but are still a carrier. Midland Mayor Patrick Payton asking the public to stay home and work to slow down that spread of COVID-19.
How many people have to get sick and die before we take this seriously? And the reality is, no matter what we do at the government level, whether it's local, whether it's municipal, whether it's federal, whether it's state, we as citizens, as free citizens, as the judge said, who cherish our freedom and our liberty, are actually not using our freedom well if we're not looking at the bigger picture and serving each other by staying home, staying in place, taking care of yourself, and not being where you do not have to be.
Mayor Payton saying that the shelter-in-place order is not the right move for the city right now. He says the goal is to get to April 4th and see where we are. Other Midland Health officials are also pleading with the public today to stay home and keep your distance. The coronavirus can live on solid surfaces for up to 3 days, and health officials say don't panic, but be cautious.
But 85% of the people are going to do just fine. This is not something to stress out about for most people, other than to recognize that you could be a carrier and spreading it to the people that are going to be vulnerable and going to get sick, and some of whom will die.
The CEO of Midland Memorial saying that there is an existing backlog of tests right now. Officials say 169 tests have been taken and only 9 have come back, 3 of those positive.
When we get a large number of reports back and a couple of those are positive, it's going to look like we've had a significant jump from one day to the next. We'll recognize that this is about 2 weeks worth of testing backlog, so it doesn't necessarily mean we've got that many new infections. We're confirming ones that already existed. Hopefully that's going to happen today or tomorrow, but we don't know.
And with social distancing, it can be difficult to see a doctor if you need to. Midland Health is offering at-home care through the app called Basin MD, which allows you to get in touch with a doctor from the comfort of your own home. For more information, you can check out the website basinmd.com. And with COVID-19 rapidly moving across the state, we still have many questions about COVID-19 and the guidelines recommended to avoid becoming infected. We spoke with Dr. Beck from West Tech Urgent Care to break down the information and share what we can do to protect everyone in our community. We asked Dr. Beck if he thinks people in the basin are experiencing a false sense of security with this low case count, as we are still waiting for dozens of results.
Yes, to answer your question, I think there is a false sense of security. We are going to see more illnesses, more diagnosis of coronavirus as time goes on. I think we've only seen the tip of the iceberg. I think we're going to see many more cases. Unfortunately, our ability to test is very limited, so we have to test only the people that fit in the CDC criteria.
And if you have any questions for Dr. Beck, you can send them our way in a message on Facebook at Big 2 News KMID or email us at KMIDnews@nexstar.tv. And for the full Q&A with Dr. Beck, you can also visit yourbasin.com. And across Texas, there have been 1,345 cases in Texas, including presumptive positives. There have also been 17 deaths so far. Those numbers courtesy of Johns Hopkins University. And more than 13,000 tests have been administered. Dallas County reporting the most cases with 247. And many still believe that the disease can't impact them as severely because of their age and good health. That misconception has led many to the emergency room. ABC's Karina Mitchell has the details.
Chicago resident Michael Bain knows firsthand that the virus shouldn't be underestimated.
It feels like you're getting beat up all the time. And then the coughing becomes pretty violent, just exasperates. the pain that you feel in your body.
The 42-year-old thought he was immune because he wasn't considered high risk. By the time he got to the ER, he didn't think he would make it. All across the country, the chilling accounts are eerily similar in how quickly the disease can strike and how varied the symptoms are. One woman in her 40s active until the virus colonized her lungs.
I was at the gym working out, and then fever and nausea kicked in.
One thing that I did notice that changed, I completely lost my sense of smell.
So patients are coming in commonly with many different complaints, but most often fever, cough, and shortness of breath.
In New Jersey, an alarming new cluster of victims. 94 nursing home residents evacuated after several patients and staff tested positive for the disease. Now, an urgent warning from the son of the first man in Milwaukee to die from complications of the virus.
I've seen the jokes, the memes, everything, but when it hits home, it has to stop, and we got to think. Family can't be able to hold their hand.
Looking back, Bain said he wished the federal government had taken the virus more seriously earlier on.
Had that been called a couple of weeks sooner, I probably would have been home already.
Karina Mitchell, ABC News, New York.